Okay, so I've just switched the recording on. For those who have just joined our webinar, then welcome to our session on falls prevention. I was saying a little bit earlier on, it's such an important topic in the context of arthritis that's often overlooked in the management. So hopefully we can kind of bridge some of those gaps, answer some of your questions, prepare you guys with knowledge and information moving forward. I will kindly ask everyone to make sure their microphones are always on mute. That just is one way of minimizing any kind of disruption. So I will continue to let people in the room. If you need to leave at any point, don't feel like you're going to miss out. You'll have access to the recording in your emails tomorrow if you've registered for our event. So I will start with just a acknowledgement of country. We acknowledge the traditional custodians of the land in which we gather today. We pay our respects to their elders past and present. I do want to start with a disclaimer as well to let you know that all the information in our webinars contain very general information and advice, and they're not intended to substitute your individual treatment advice. If you have questions that come up relating to your individual treatment plans, your medications, I will always direct you to your primary healthcare physician, whether it's a rheumatologist, a general practitioner. But I'll do my best to help you out with questions that relate to the information we're covering today. So if you do have questions that come up throughout today's session, feel free to pop them into the chat box, but I'll also make sure we get some open discussion time at the end of the session, because I think that's where a lot of value can be held in these online webinars and attending the live stream. So I definitely want to factor that in. We will be talking a little bit about why falls matter today, some of those risk factors to be aware of. We'll talk about prevention strategies in the conservative space, so talking more about the role of exercise and nutrition, and making sure you've seen a podiatrist if you are a high risk at high risk for falls, and then link you into some supports and services. So we'll start off and kick off the conversation in terms of why we are talking about falls today. I did touch on that earlier, but we know that people with living with arthritis are more than twice as likely to have a fall compared to those without arthritis. So if we're looking at the statistics, we have about half of all adults with arthritis who report having at least one fall each year. So that's quite prevalent. And the thing about falls is that they aren't just minor accidents for some people. They're actually one of the leading causes of injury related hospital admissions for older adults. So it's a very important topic. Sometimes we have side effects from medications that can play a role too. So up to 25% of arthritis related falls are actually linked back to the medications we're taking, and most falls, more than 60%, happen in or around the home. So this is why falls prevention is really important. And we're going to focus on the very few but meaningful changes that can be made in our own homes and our lifestyles and with our daily activities to help manage that risk. So if we look at the reasons why arthritis can actually increase the risk of the fall, we first have pain and stiffness. I'm sure most of us who have arthritis can relate to that. We know it's a painful condition, and that can make it harder to move freely or react quickly. So when you have your load-bearing joints, so we're talking about the knees, the hips, the ankles, the feet, and they become weakened or even deformed by arthritis, that's when they can become unstable. So you might feel like you're walking and then a joint might give way, which makes the fall more likely. If anyone's here heard of if you don't use it, you lose it. Have we all heard that saying before? This is because over time, the muscles that actually support our joints do get weaker, and particularly in the legs and the core. And so you think about these joints, they have a very crucial role in providing us with balance and stability. So as we get older, it's very natural that our muscle mass starts to decline. So we see this decline start to happen naturally and progressively after 60 years old. So it does take more effort in terms of what we're doing with our exercise and nutrition to maintain that muscle mass. And then, of course, we've got the fatigue, we've got medication use, we've also got reduced proprioception, which is something I'm going to talk a bit more about shortly, which can all impair our ability to notice hazards. So it's all about, managing those risks in terms of balance reactions or avoiding obstacles. And so there's a lot of different ways physically and cognitively arthritis can increase our risk of falls. So I mentioned this thing called proprioception. Have any of us heard this word before? Do we know what this is? Looking at some of the cameras shaking their head. Proprioception is basically the sense that tells our brain where your body parts are in space. It tells our brain how the body parts are moving, the amount of force or effort that's being used. And so you can almost think of it as being your sixth sense. So it allows you to move without consciously thinking about every action you take. So walking without watching your feet, scratching your nose with your eyes closed. These are all things related back to proprioception. So there are a few different feedback mechanisms in how proprioception works to send information to the brain and back. For one, it relies on very special sensory neurons that are located in our muscles, our tendons, our joints and ligaments. And these receptors detect things like the stretch and the length of muscles. It detects tension and load in tendons and joints. It detects joint angles and pressure, speed and direction of movement. So these signals are constantly communicating to our brain to update your body's map of itself. You also have the neural pathways involved where signals from proprioceptors traveled through different sensory nerves. So they talk to the spinal cord. And so the sensors in your bodies send messages to two key brain areas. You have the cerebellum, which is basically the part of the brain responsible for coordination and balance. And then you have something called the somatosensory cortex, which helps your brain understand your body's position. So your brain sends messages back to your muscles, it adjusts and fine-tunes your movements, and then it talks back to the brain. But these feedback loops are really important for our smooth, coordinated movements. It's important for maintaining balance and posture, preventing falls, adjusting external forces. And so this is where we talk about the implications of having arthritis. This proprioception, this sixth sense, is often impaired. So this contributes to the joint instability we could be experiencing. It could be, sorry, I'm just letting some people in. It could be reduced balance and the increased falls risk. And it happens because arthritis, it doesn't just affect those structures in your joints. So if we think of what's happening with the changes in the muscle, with the cartilage tissue, the fluid, the structures in the joint capsule, those structures are implicated, but it's also about what's the input that's going to the brain and the nervous system's ability to process it. You'll know that when you have chronic pain, the processing of information changes rapidly in your body. So in osteoarthritis and rheumatoid arthritis, damage or swelling in the joint can actually lead to weaker or distorted sensory input. It can reduce the accuracy of those signals going to the brain and back to the muscles. Chronic joint pain can also cause protective movement patterns. So if you've ever wondered why you're maybe limping one day, or you're feeling it really tense in your muscles, or maybe your physio has picked up on it. So chronic, these patterns basically limit your joint range. they can limit the motion, the use, and this can actually lead to disuse of very important muscles, can lead to reduced effectiveness of those senses that support proprioception. So this is why arthritis can make you more likely to misjudge steps. It could make you likely to fall on uneven surfaces, and there's a higher risk of falls and joint re-injury. There we go. So osteoporosis, who's had this conversation before with their doctors? If you're not sure about what osteoporosis is, let's catch everyone up. I want you to think of bone and joint changes. They don't just happen overnight, they build up over time. So, osteoporosis is what we call a silent disease. It's a degenerative condition of the bones, and it progresses quietly without any symptoms. And we might not know we have it until we do fall and maybe a fracture occurs. So, while some bone and muscle loss is a natural part of aging, there are many factors in our lifestyle that can either speed up or slow down that process, like not exercising, not getting enough calcium or vitamin D, maybe high alcohol use. And then there's, of course, things we can't change, like age, genetics, and medical conditions that make us more susceptible to this bone loss. So, where this disease fits into this is a bit more complex. Some chronic conditions like rheumatoid arthritis fall more into the non-modifiable category. They're not caused by lifestyle choices, but how those diseases are managed, that's where it is modifiable. So chronic inflammation, for one, is very common in inflammatory types of arthritis, but it is known to accelerate bone loss. And then you also have some medications that for example, like corticosteroids, which is used to manage inflammation, that can also weaken bones over time. So it's a bit of a catch-22, which just tells us that more ongoing, frequent monitoring of the bone density is going to be really important. So it's really important that we understand the link here, because when you combine weaker bones with joint instability, the risk of serious fractures from falls rises, especially in those high risk areas like the spine, the hips, wrists. And it's really important to keep an eye on that bone density, particularly as you're getting older. The good thing is you can check the status of your bone health. So if you've ever heard of a DEXA scan, osteoporosis, it's usually diagnosed through not just assessment of risk factors, medical history, there would be a screen of what medications you're taking, but the gold standard is a DEXA scan. And these DEXA scans are usually offered for free at 70 years and above. You might be eligible for free or at the very least a subsidized DEXA scan if you're under 70, depending on your medical history or the medications you're taking. So if you do have an inflammatory type of arthritis and you are taking medication to manage it, you can have that conversation with your doctor to see if it could affect bone loss and if you're eligible to get that DEXA scan. So when you do have this DEXA scan, you are given something called a T-score, which is a comparison of your bone density to that of a younger, healthy adult, usually around age 30, of the same sex. So if the T-score comes back and it's between 1 to -1, this just means you're going to get the green light to keep doing what you're doing. What you're doing is helping your bones. It means you're at a very low risk of falls and fractures and low risk of osteoporosis. So it's a good indicator that you've got good, healthy bones. If you're getting a score between -1 to -2.5, this is where we consider this an osteopenic range. You might want to consider starting to make those changes in your diet, look at the exercise you're doing, And talk to your doctor about strategies to minimize any further bone losses because it's very possible at this time to get back into a healthy category and make sure you're reducing that risk of osteopenia. Osteopenia, you can imagine your bones being very soft and very crumbly. Um, so you want to make sure that you're doing what you can to actually build that bone back up. If it is negative 2.5, it could mean that you do have osteoporosis. And so there would be significant caution needed around falls and fractures. And your doctor would very strongly suggest you start treatment right away. So you want to get back into a less riskier range. So they're going to start with a medication, but they will also talk to you about those things like exercise, vitamin D, calcium, and more. So the good news about you all attending this webinar today is that it's never too late to actually improve your bone health. And we have a few things that we can actually do to reduce our risk of falls. So everyday things you can do to bring and make your bones, bring them into a healthier, less risky zone. And movement and exercise for one. So your muscles are connected to tendons, which are attached to your bones. So every time you move, but especially during that weight bearing or load bearing impact exercises, those muscles pull on the bones. That pulling action stimulates your body's ability to strengthen the bones. I'm going to trigger very important hormones that help rebuild and strengthen that bone. But it's not just about bones here as well. So movement, it also keeps your joints nourished and healthy, which can slow down the progression of arthritis. And this is why we do talk a lot about exercise in the realm of arthritis management. You can think of exercise as giving you a double whammy of benefits. So stronger bones, healthier joints, plus it improves your strength, balance, and coordination, and that proprioception I was telling you about, all which is really important for protecting against falls and fractures. We also have healthy food. So bones are essentially built from nutrients. So things like calcium, vitamin D, magnesium. But the thing about these dietary factors is our bodies don't make them on their own. We have to get them from somewhere. This is why we talk about the importance of having a healthy, balanced, nutritious diet full of healthy foods. Because when your body gets the nutrients it needs, it can maintain those strong bones, can play a role in maintaining that muscle mass, and which is very important if we're talking about fall prevention, but also keeping you very mobile, very active and independent. You also have the thing about joint protection. It is all about reducing strain and stress on your joints. It's about managing pain and preventing any further damage, which is crucial for that long-term fall prevention. For some people, this could mean using those assistive devices, exploring those options and what's going to make those daily activities easier for you. For others, it could be simply about learning how to move more efficiently and respecting those pain signals. Pain, I always say or compare it to your body's alarm system. It's always going to be a signal to slow down. Um, when you do push through it, because I know there are some people who have that tendency, to ignore pain signals, it can actually increase your risk of falling. So it is that tricky balance, because we take medication, and the main reason is to actually help manage that pain, unless we are taking it to manage disease activity. But we take it to manage pain, but some of these medications can affect things like balance, alertness, blood pressure, even muscle control. So medication reviews are super important, and I'll circle back to that. And then there's sleep and recovery. So I'm going to circle back to sleep and recovery in a minute. I just want to circle back to movement and exercise. We have skeletal muscles that basically surround our joints. And I said earlier, they allow for smooth, controlled movements, when you have muscles like the quadriceps, hamstrings, glutes, calves, when they're strong, they're able to stabilize joints by absorbing and distributing mechanical loads. When you have muscle weakness, it can't exactly provide this kind of this equal support. So you have more force that's transferred directly to the joint structures, and this is why weight management has an important role in not just pain management, but has long-term protective effects in many ways. But that direct load on your joint is only going to increase that wear and tear and the instability. So it also feeds into that pain cycle. Now, all exercise is good for your muscles, joints, and stability, but different types of exercise deliver different benefits. So, for example, you have muscle building activities. So, you can think of this as resistance or strength training, which work by putting controlled stress on your muscles to help them grow thicker and stronger. Um, so some people can think of resistance and strength training exercise like going to the gym and smashing those weights. But if you're not a gym person and you're not a weightlifter, that's absolutely fine. That could also translate to doing your gardening, digging some trenches with a shovel. But that resistance and that strength is going to help with that muscle building. So we also talk a lot about osteogenic activities. If you've ever heard of osteogenic, it basically means bone loving. And so bone loving exercises, you have highly osteogenic activities, which are resistance training and weight bearing exercise. Could look like going to the gym or doing that gardening. It could also be getting that resistance band out and doing your stretches on the couch while you're watching your favorite TV show at nighttime. So these type of exercises are going to not just help your bones, but they're going to help the muscles, and it's going to give them the healthy stress they need to stay strong and adapt. You have moderately osteogenic activities, which are still very beneficial. Things like walking, stair climbing, dancing, the Bollywood dancing, they might not build as much bone as lifting weights, but they're still going to help maintain and protect what you've got there. And then you have the completely different category of exercise, which is proprioceptive activities. So movements and activities that specifically activate those receptors I spoke to you a little bit about earlier on. Those proprioceptors are in the muscles, tendons, joints, even in the inner ear. So these activities can improve your body's awareness, control. There was actually a systematic review in Age and Aging back in 2015 that found that balance and proprioceptive training significantly reduced the incidence of falls in a community dwelling of older adults. So this is why when we talk about Tai Chi and yoga, there is a strong evidence base behind those exercises for falls prevention. So the great thing is with all these exercises, you can mix and match them throughout the week, depending on your ability, your comfort, your lifestyle, what's accessible to you. If the activity involves any kind of load, endures force, you can think about it being very good for your bones, also very good for your joints, and overall good for preventing falls. We have a recommendation of half an hour a day, but overall, we just try to say that exercising for as often as you can and on most days is a pretty good goal to have. And the thing with exercise, it's not just about your joints and your muscles, it trains your whole system. It's about the brain, the nerves, the muscles, connective tissue, even your cellular signaling and repair. So we could get very granular with that, but I will move on to the next domain of, how we can protect our bones, muscles, and protect against falls. I mentioned earlier that nutrients are really important for our health. If we're talking about the nutrients of the greatest importance for strength, bone health, balance, even neurological function, we're talking about protein, calcium, and vitamin D. And so we can be including these in our diets on a regular basis, but it's also about ensuring you have enough to reach the daily targets that protect against that degeneration and breakdown of bone, muscle mass, and the other structures in the body. Protein, for example, you can think of as being very essential for building, repairing, and maintaining muscle tissue. If we're getting technical, the recommendation is about 1.2 to 1.5 grams per kilogram of body weight per day, which is a requirement to meet the basic needs for protein. So you could speak to a dietitian who can calculate this specifically for your needs. This is where they have a really important role. But if you're 70 kilos, that might look like 80 to 100 grams per day. And how that translates, if we're talking about food intake, it's a couple of eggs for breakfast. It could be some chicken or tofu in your lunch. It could be a yogurt as an afternoon snack. It's some fish or steak for dinner. 3 to 4 serves of protein per day is going to be a good target to ensure you're meeting your basic protein requirements. Calcium targets again. So if you didn't know how much calcium we should be eating, when I've traveled out to communities, I make them play the Price is Right and guess how much calcium we need. But 1,300 milligrams per day. For some people, that sounds really high. But if we're translating that to our intake, in reality, it could equal 2 40-gram blocks of cheese, 1 small tub of yogurt, and 1 cup of milk, and those calcium needs for the day are met. So it sounds like a lot, but it's quite an easy target to hit when you have that overall well-balanced diet. If dairy is one of those foods that don't agree with you, because essentially that's where most of your calcium is found, you do have lactose in, free options, and there are many alternative options to make sure you're hitting the target. You can always look at your food products and make sure it's fortified. Sardines, salmon, small bony fish, legumes, pulses, they will deliver the same, if not more, bang for your buck in terms of calcium and protein. Although we can be getting all the calcium from our foods in the diet, it ultimately goes hand in hand with vitamin D. And this is why we talk a lot about the importance of vitamin D. We need this nutrient to help facilitate our absorption and storage of calcium. I always compared bone to basically being a massive calcium bank. Vitamin D is going to be absolutely essential for regulating that calcium in the blood. When calcium's not in use, it's essentially helping storing it away in the bones. And so you can get a little bit from our foods like our milk, our eggs, salmon, mushrooms if they've ever been exposed to sunlight. They're great sources of vitamin D, but sunlight is always going to be the best source of vitamin D. How much sunlight we need, it does fluctuate across a year because the exposure changes between summer and winter. It also changes for people with a fair skin complexion and a darker skin complexion. For moderately fair skinned people, you need about 6 to 8 minutes of sun in summer, and in winter, it could be up to 25 minutes. And then if you have a darker complexion, it could be a little bit longer than those time limits. But to get as much sunlight as possible to synthesize enough vitamin D, just showing 15% of your skin. It could be through just wearing a t-shirt outside on your balcony while you're drinking a cup of tea. Could be wearing some shorts while you're taking the dog for a walk. But that should be a sufficient way to get that vitamin D target met for the day. The good thing is with vitamin D, unlike protein, and you can somewhat check calcium, but with vitamin D, you can do a blood test and you can check where those levels are at. And it could be a good idea to check them across the year because in winter time, we can expect those levels to be lower. In summer, they should be higher. And if you are lacking in vitamin D, there are supplements that are available to help you correct those levels. So the link between diet and fall prevention, it is often overlooked, but it's a really important part of supporting muscle strength and bone health, even just general energy levels and brain function. So while you have some key nutrients that are clearly better for bones and muscles, so for muscle, protein can deliver immense amount of benefits. Calcium and vitamin D are key players for bone. For proprioception, it could be nutrients like B vitamins, omega-3 fatty acids, antioxidants, but overall, a well-balanced, nutrient-rich diet across all the food groups is going to be the best, the most powerful modifiable strategy you can do to reduce that falls risk. To get those nutrients boosted in your diet, there are plenty of opportunities available to you depending on what your diet currently looks like. Could be adding a handful of veggies to your sandwich or your dinner at night. It could be including a source of protein at each meal. So tuna is always great in a salad. Sardines on crackers make a great snack. You could have berries and oranges with your breakfast cereal. But this is where it could be very valuable to speak to a dietitian or a health coach or a nutritionist in navigating those food choices, particularly if you find yourself in that high risk category for a fall. So, one of the simplest and most often overlooked strategies as well to protect your joints and prevent falls are your shoes. And I'm not sure how many of us here have um, looked at changing our footwear, but the shoes we wear every day can affect our alignment and that can affect our stability. And it can also have some role in joint protection as well and helping with that pain, especially in the knees, hips, and back. So, what should we be looking for? First, choosing shoes with firm soles. They will give you a very stable base to walk on and help prevent your feet from twisting unexpectedly. If you want a shoe with good grip or tread, that's going to be helpful for reducing that slipping, particularly in the household. If you have tiles at home or wet ground, it's one of the simplest ways to reduce your risk of falls. Low supportive heels, so avoiding those high heels, which can affect your alignment, but also steering clear from those very flat ballet flats and thin sandals. Enclosed shoes are going to be best, meaning they're going to help hold your foot securely in place and reduce the risk of the foot sliding or the shoe slipping off. And then finally, orthotics or built-in arch support. They're very effective for correcting posture, reducing pain and load on your joints. And so if you do have issues like flat feet or plantar fasciitis, it's not always about fashion, it is about function, safety, and comfort. So if you're unsure whether the footwear you are wearing at the moment is right for you, this is where a visit to the podiatrist can be a real game changer. They can look for things like worn out soles, poor grip, lack of arch support, or overly flexible shoes. And they can look at specific types or brands of footwear that offer all these things we went through. They can also make observations on how you walk, look at the gait, and identify any issues in foot placement or stride that could lead to those trips and falls. So, medications, I mentioned for many, is a big part of managing arthritis and pain, but they can be a major risk factor for falls. We have studies that tell us about 20% of people who have osteoarthritis, and an estimated 12.5% of people with rheumatoid arthritis are on a long-term opioid. So this could be oxycodone, endone, codeine, or any variant. And we know that for osteoarthritis and rheumatoid arthritis, this isn't the recommendation for long-term management. Not only does it provide no benefit, but it can cause that significant risk of harm. And we know that in the context of people who take regular opioids are at greater risk of drowsiness, falls, fractions, but also addiction potential and those unwanted side effects. So we have a lot of research that show that opioids are not particularly effective in the long term. If anything, they're going to confer about a 30% reduction in pain. But when you compare that pain relief to what you can get from exercise, it's exactly the same. From exercise, you can also get a 30% reduction in pain. The risk here is that over time, the body can build a tolerance to opioids, meaning that over time, higher and higher doses are going to be needed to get that same effect. So, this not only feeds into that addiction cycle, but it does put you at a serious risk of falls when we're talking about the drowsiness and dizziness and confusion, poor balance. Um, and this is why the overall risk is quite high. So even with sleep medications, these drugs are designed to slow down brain activity to help you sleep, but they can also cause things like daytime drowsiness, slower reaction times, confusion, and poor coordination. So even if they're taken at night, the effects can linger and feed into the next day. So if you're someone who does struggle with the grogginess upon standing or walking, it could be an important conversation to have with your doctor. So, antidepressants also affect brain chemicals, which can alter balance, alertness, and coordination. Some can cause low blood pressure, dizziness, or muscle weakness, particularly when standing up. So, sedatives, antidepressants can reduce the body's ability to react quickly to obstacles or changes in terrain, and it does increase the risk of falls. And then, if you're very new to blood pressure medications, it's not uncommon if you're starting out that your blood pressure can be lowered too much, which can lead to that lightheadedness and fainting. So there's always going to be some kind of benefit to taking medication, but it does need to be weighed up against the risk of harm. And this is why it's really important to have open, thorough conversations with the GP, even the pharmacist, um, especially if you do experience those symptoms like lightheadedness, you feel faint, or not feeling quite right. You are very well in your right to have a conversation with your doctor. If you've had a fall, um, definitely worth bringing up with your doctor as well. The risk is always going to be greater when multiple medications are taken together as well, because a lot of the time they can interact with each other. Now, we also have the importance of sleep. So, poor sleep, it's not just tiring and exhausting. And I definitely know that because having a baby, you feel the effects of sleep deprivation, that's for sure. But it can be dangerous as well. And sleep deprivation has been linked with 2 to 4 times greater risk of falls, especially in older adults where reduced alertness and balance can be life threatening. 70% of increased risk of workplace accidents. Fatigue slows your cognitive abilities down a lot. So it can slow your ability down to spot and respond to those hazards. It does result in 50% slower physical and mental reaction times. So prioritizing good sleep is going to be equally important to exercise, diet, and joint protection. Everyone's sleep needs do vary though. So some do naturally require less and others need more. We've all got different kind of ways we function on different amounts of sleep. A lot of individuals though underestimate their need for sleep, but the long-term health benefits often require more than what's perceived. So your standard guidelines, if we go back to those, they do suggest about 7 hours of sleep is a good sufficient amount to get the benefits of good sleep. But hitting this target can be challenging, especially if you live with a chronic pain condition, so arthritis for one. So quality sleep is going to be essential for that rejuvenation, restoration, and contribute to overall health and well-being. So there are a few things we can do to actually improve this. So sticking to a regular bedtime routine, waking and a regular waking up time is really important for helping regulate your body's internal clock, making it easier to fall asleep over time and then wake up feeling refreshed. Avoiding caffeine, alcohol, screens late in the evening, these are all very stimulating in the brain. They do affect the chemicals that are meant to make you feel sleepy. So they can prevent those from being released in many ways, making it harder to get to sleep. Trying a gentle stretching or relaxation routine before bed. Gentle stretching is such a simple but effective way to actually relax the body and calm the mind. So it can be really helpful before bed, but even during pain flare ups. You can use pillows for joint support and comfort. This can make a big difference in managing the pain you experience. overnight, especially if you're dealing with arthritis in the spine or the hips. Supporting the neck, spine, hips, and knees with the right pillow setup is very effective for easing stiffness and preventing that discomfort, which will help you feel rested the very next day. So things like keeping a nightlight on to reduce risk of falls at night can be very beneficial. And if you do experience sleep issues, this is where talking to your doctor can be important. They might look at adjusting your medications, or they could recommend something like cognitive behavioral therapy to treat insomnia if that's the issue that's causing you to stay awake at night and prevent you from getting that good quality sleep. Has anyone heard of the Stepping On program or are currently part of it? No. So, your Stepping On program is a community based, evidence backed falls prevention program. It's run by the government and designed for older adults who are living at home and want to improve strength, balance, and confidence to reduce risk of falls. So, it's a 7-week program. There's usually one session that's per week, runs for about 2 to 3 hours long, and it's led by a trained health professional or a facilitator. And so they'll have they use a multidisciplinary approach. So they'll invite physios, occupational therapists, pharmacists, vision specialists to talk to you about fall prevention strategies. But it's backed by very sufficient evidence. So there's been research into this program, which is why it's still continuing to be funded and implemented in the community. They found that the participants in these programs experience up to a 31% reduction in falls. It's proven to help improve confidence, encourage independence, and it's also a great way to actually connect with peers through group learning and open discussions. So it can be really ideal for people who have had a fall or concerned about falling. Um, so it could be a really good program to explore for you, and you can see if it's available in your community. You just have to jump online and look at the Stepping On program. Tai Chi, on the other hand, is a very gentle, low impact form of exercise, which has proven to significantly reduce risk of falls, particularly in older adults who have balance or mobility challenges. Recently, we launched our own Tai Chi arthritis program. It's a virtual group movement program designed to help you, if you're living with arthritis, learn safe and suitable ways to exercise. Each week, you can join into the class from the comfort of your own home, which is a bonus. And it's a 12-week program that's designed to keep you motivated and offer support. So you can also explore that program on our website if you haven't come across it just yet. So I thought I would leave some time for questions. What I will do is switch off the recording so we can have an open discussion.